रिमेंबर तीनों जर्म लेयर से बॉडी के अलग अलग ऑर्गन्स बनते हैं. So what is the fate of the three germinal layers? Sir, you have fate of ectoderm. Ectoderm is the uppermost layer and it forms the uppermost parts of the human body. Sir, तो कौन-कौन से parts ectoderm से बनते हैं? It forms the lining epithelium of the skin, epidermis layer. Skin की epidermis layer develops from the ectoderm. Skin be remember made of two layers, dermis and epidermis. Below is the dermis, upper is the epidermis. Ectoderm forms the epidermis layer. It forms the nasal cavity. It forms the oral cavity. And it forms parts of the ear. So, sir, nasal cavity, as a matter of fact, lips, cheeks, the inner lining, mouth, buccal cavity, ear canals, all these are developed from the ectoderm. And parts of the eye, cornea, conjunctiva, iris, etc. develop from the ectoderm. Ectoderm से cornea, conjunctiva, iris बनता है. Cornea is the transparent coat over the pupil. तो we remember pupil होता है, there is iris muscle के बीच में pupil होता है and covering it is the cornea. तो cornea है, फिर conjunctiva है, iris muscle है, all these develop from the ectoderm. And we have lining of the mouth, stomodium and anus called proctodium. तो oral lining stomodium and anus lining proctodium, they develop from the ectoderm. So ectoderm says stomodium and proctodium, that is the stomodium in oral lining and anal lining called proctodium, they develop from the ectoderm. Ectoderm also forms glands, sweat gland, sebaceous gland, salivary gland, lacrimal tear gland, mammary milk gland. You have sweat glands and then sebum given by sebaceous glands. You have salivary glands, mammary glands, and lacrimal tear glands develop from the ectoderm. Also, endocrine glands, posterior pituitary and adrenal medulla develop from the ectoderm. So, your pituitary gland is made of two halves, of which you have something called as anterior pituitary and you have something called as posterior pituitary, of which posterior pituitary develops from the ectoderm. Ectoderm develops into the posterior pituitary. Just above the kidneys are found adrenal gland. Kidney के ऊपर adrenal gland होते हैं. Adrenal gland has two parts. The middle called as the medulla and surrounding the medulla is the cortex. So middle is medulla, surrounding the medulla is the cortex. The adrenal medulla develops from the ectoderm. Ectoderm develops into the adrenal medulla. And ectoderm develops hair, nails, tooth enamel. So आपके hair, आपके nails, आपका tooth का enamel. So your tooth is made of two parts. Inside is a bony structure which is called as dentine, and outside is the shiny layer called as the enamel. So whenever we brush our teeth, we are brushing the enamel of the tooth. And where does this enamel develop from? Enamel develops from the ectoderm. And lens of the eye. Remember cornea, conjunctiva, iris, and the lens develops from the ectoderm. And nervous system, your brain, spinal cord, cranial nerves, spinal nerves, your entire nervous system develops from the ectoderm. So ectoderm से nervous system बनता है. And then we have the mesoderm. Mesoderm forms the skin dermis layer. If you remember, skin is made up of epidermis and dermis. Epidermis develops from the ectoderm. Dermis, the lower layer, develops from the mesoderm. And mesoderm forms pericardium, peritoneum and pleura, that is lung covering. So, we remember abdomen we have supporting membranes called peritoneum. Peritoneum develops from mesoderm. Around the heart is a protective covering called as pericardium. And around the lungs are protective coverings called pleura. Both pericardium and pleura develop from the mesoderm. Around the brain are found protective coverings called meninges. The brain meninges are also developed from the mesoderm. And then we have organs of the circulatory system. Heart, aorta, blood vessels develop from the mesoderm. Organs of digestive system, esophagus, stomach, small intestine, large intestine develop from the mesoderm. Organs of the excretory system, kidneys, ureters, etc. develop from the mesoderm. Organs of the reproductive system, testes, vasa deferens, etc. develop from mesoderm. Ovaries, fallopian tube, uterus, vagina develop from the mesoderm. So circulatory system, digestive system, excretory system, reproductive system develop from the mesoderm. And then we have connective tissues. So जहाँ packing tissue called connective tissue है, they develop from mesoderm. And we have bones, cartilages and muscles, striated, non-striated and cardiac muscle. Bones, 206 bones we have in our body, they all develop from the mesoderm. Muscles, you have striated, skeletal muscles. 639 skeletal muscles we have in our body, they all develop from the mesoderm. Smooth muscles, esophagus, stomach, small intestine, large intestine, wherever there is peristalsis, involuntary movements are done by non-striated muscles, they develop from mesoderm. So voluntary muscles develop from mesoderm, that is striated. Involuntary muscles which are non-striated all develop from the mesoderm. Cardiac muscles on the heart develop from mesoderm. And adrenal cortex, middle ear and dentine of the tooth develop from mesoderm. So adrenal medulla, we remember, develop from the ectoderm. Adrenal cortex develops from the mesoderm. Adrenal cortex develops from mesoderm. And middle ear and dentine of the tooth. We remember tooth के दो part है. Outer one is called enamel and middle part is called the dentine. Dentine is the bony part. If you remember, bones develop from mesoderm. So dentine, which is the bony part, the dentine will develop from the mesoderm. And middle ear. Sir, ear में तीन parts होते हैं. You have the pinna and the external ear. And then we have eardrum. And eardrum के अंदर we have three bones, malleus, incus and stapes. And then we have cochlea. तो ये है external ear, which is the ear canal. We have malleus, incus and stapes. This is the middle ear, which is made of bones called malleus, incus and stapes. And we have the cochlea, from which arises nerves, and that is called cochlea, also called as internal ear. And cochlea or internal ear has the auditory nerve coming out of it, of which external ear, where sound waves hit the eardrum, external ear develops from the ectoderm. The cochlea or the internal ear also develops from the ectoderm. But the middle ear, which is made of malleus, incus and stapes, bones, is made up of malleus, incus and stapes. The three bones, they develop from the mesoderm. They develop from the mesoderm. So where does external ear and internal ear develop from the ectoderm? Where does middle ear, malleus incustate bones develop from the mesoderm? So ये mesoderm के organs है. Endoderm to start with forms the inner lining of the alimentary canal. Endoderm से inner lining of alimentary canal except floor of mouth and lower part of anus. The entire pharynx, larynx, esophagus, stomach, small intestine, large intestine, internal lining is made up of endoderm except the stomodium and proctodium. We remember the stomodium and proctodium develop from the ectoderm. Stomodium and proctodium develop from the ectoderm. Otherwise, everything develops from the endoderm. So, sir, entire inner lining of digestive system is from endoderm except stomodium and proctodium. And then we have respiratory system. Lungs, trachea, bronchi, everything develop from endoderm. They develop from endoderm. And sir, you have gallbladder, pancreas and bile duct. As a matter of fact, even the liver. So you have liver में से आता है gallbladder से आता है bile duct, along with it pancreas से आता है pancreatic duct. All these digestive glands. All these digestive glands, that is the liver, the gallbladder which gives bile, pancreas which gives pancreatic juice, they all develop from the endoderm. And then sir, you have vagina, vestibule and urinary bladder and urethra. Sir, where does digestive system develop from? Mesoderm. But the last part of the digestive system, that is the anus, we remember is lined by the ectoderm. Similarly, for excretory system, sir, where do kidneys and ureters develop from? The mesoderm. But the urinary bladder and urethra lining are the endoderm. Similarly, reproductive system, where do ovaries, fallopian tube, uterus develop from? The mesoderm. But where does the opening vagina, vestibule develop from? The vagina, vestibule develop from the endoderm. And you have eustachian tube which connects middle ear to the oral cavity. Sir, from the middle ear, एक tube आती है called as the eustachian tube which opens into your mouth, and this eustachian tube develops from the endoderm. Eustachian tube develops from the endoderm, and eustachian tube is there. Why do we have it, sir? Sir, inside the middle ear we have malleus incustate 3 bones, and there is an air cavity. Now, what will happen if you sit in a plane and you go upwards, 35,000 feet up above? So, sir, outside the air pressure will become less, and inside the middle ear, the air pressure will increase. Air will always go from high pressure to low pressure, and that means air will start going from middle ear to the outside and will create a lot of pressure on your eardrum. And your eardrum पे pressure आएगा, that will cause pain. तो आपको एक plane में बैठते tingling sensation कानों में होता है. That is because air is trying to go from middle ear to the outside. Immediately, what are you supposed to do? Open your mouth and ha करके blow out करने का. That will help in the opening of a tube called as the eustachian tube, and air will not go out through the ear. It will go into the eustachian tube into your mouth, and via your mouth air will go out. So air pressure inside the eustachian tube will decrease. So this is a beautiful logic. You learn this later. Where does this eustachian tube develop from? Eustachian tube develops from the endoderm. And you have glands. glands of the stomach and intestine. Stomach or intestine give out juices for digestion. All these digestive juices are produced by the endoderm. And you have prostate gland developing from the endoderm. As a matter of fact, reproductive system develops from the mesoderm, but your three accessory glands, seminal vesicle, prostate gland, Cowper's gland, develop from the endoderm. Similarly, in females, Bartholin's gland, Keele's gland develop from the endoderm. And you have endocrine anterior lobe of the pituitary. So remember, posterior pituitary is ectodermal, but anterior pituitary is endodermal. Anterior pituitary is endodermal. And you have thyroid gland, parathyroid gland, thymus gland, islets of Langerhans of pancreas. सुना है pancreas में होते हैं islets of Langerhans. They give out insulin and glucagon. Where do islets of Langerhans and pancreas develop from? Endoderm. Where does thyroid gland develop from? Endoderm. आपके chest में होता है gland called thymus gland. It is concerned with immunity of the body. In these corona times, very important gland, immunity wala gland. So sir, where does this thymus gland, which is concerned with immunity, develop from? Endoderm. So ये endoderm wala gland है. Right. So sir, we have done the fate of the three layers. Just a quick fire revision. Where does nervous system develop from? Ectoderm. Where does respiratory system develop from? Endoderm. Where do all other systems develop from? Mesoderm. Digestive system, circulatory system, excretory system, reproductive system, 206 bones, 639 muscles. Where do they all develop from? The mesoderm. Sir, where does hair, nails, etc. develop from? Ectoderm. Sir, where does parts of nose, parts of mouth, parts of ears, etc. develop from? Ectoderm. Sir, where does pericardium, pleura, peritoneum develop from? Mesoderm. Similarly, sir, where does your different now 2 to 1? Where does epidermis develop from? Ectoderm. Where does dermis develop from? Mesoderm. Where does posterior pituitary develop from? Ectoderm. Where does anterior pituitary develop from? Endoderm. Where does adrenal medulla develop from? Ectoderm. Where does adrenal cortex develop from? Mesoderm. Where does enamel of a tooth develop from? Ectoderm. Where does dentine of a tooth develop from? Mesoderm. Where does external ear and internal ear develop from? Ectoderm. Where does middle ear, malleus intestine bones develop from? Mesoderm. Where does eustachian tube develop from? Endoderm. Where does stomodium and proctodium, lining of oral cavity and anal cavity, develop from? Ectoderm. Where does remaining lining of the digestive system develop from? Endoderm. And sir, where do your glands, sweat gland, sebaceous gland, salivary gland, mammary gland, lacrimal tear gland, exocrine gland develop from? Ectoderm. Where do endocrine glands, pancreas, thyroid, parathyroid, thymus, etc. develop from? Endoderm. So इस तरह से सारे organs develop हो जाते हैं. So sir, this is the fate of the three germinal layers, which is a beautiful concept. You will study in first MBBS how the organs are formed from all the layers, and then we have a phenomenon called amniocentesis. So a beautiful concept है. If you have heard of it, many women, if they are becoming pregnant after the age of 35-40 years, it is not good for the child. The child may develop something called as Down syndrome. And if this baby is born with Down syndrome babies are physically retarded, mentally retarded, they have cardiac problems, and they may die at an early age. And Down syndrome में होता क्या है? Sir, in a cell we have 22 pairs of chromosomes. एक सेल में हमें 22 pairs of chromosomes होते हैं, that is autosome, and one pair of sex chromosome, X and Y chromosome. So sir, we have 22 pairs of autosome, X and Y sex chromosome. So we have 23 pairs of chromosomes, in other words 46 chromosomes. In a child with Down syndrome, the 21st pair of chromosomes, instead of 2 chromosomes, there are 3. So third 21st chromosome आ जाता है. So we have 1, 2 and 3 21st chromosome, and that is a condition called as trisomy 21. Trisomy 21, which is now Down syndrome. तो ऐसे बच्चे जब born होंगे, they will have physical retardation, mental retardation, and very bad life, and they will die early. So sir, what will you advise for women if they are having a child after the age of 35-40 years? We will detect Down syndrome as early as the pregnancy stage itself. तो प्रेगनेंसी में ही हम लोग डाउन सिंड्रोम को डिटेक्ट कर लेंगे. हाउ डू यू डू दैट? Sir, while the lady is having a pregnancy, she is at risk. She is already 40 years of age. Baby को Down syndrome हो सकता है. We will make her lie down and we will do a technique called as amniocentesis. What is the technique called as? Amniocentesis. नाम से मालूम पड़ रहा है, amniocentesis के अंदर we will check amniotic fluid containing fetal cells. Sir, हम लोग करेंगे क्या? We'll make the lady lie down and we will take an ultra thin needle and put the needle inside her abdomen. So she's got a swollen abdomen. The needle will pass through the uterus, into the chorion, into the amnion, and enter the amniotic cavity. Immediately, what will enter into the needle? Amniotic fluid, and amniotic fluid will enter into the needle, and we will collect the amniotic fluid along with it cells of amnion and chorion. तो amnion and chorion cells इसके अंदर कलेक्ट हो जाएंगे. तो amniotic fluid के साथ amnion chorion cells आ जाएंगे, and we will put the amnion chorion cells under the microscope and detect the 21st chromosome whether it is trisomy 21 or not. But sir, ये तो amnion chorion है, ये हमने fetus के सेल थोड़ी लिए हैं. So sir, I hope you remember, where does fetus develop from? Embryoblast. Fetus develops from embryoblast. Where do amnion chorion develop from? Trophoblast. Amnion chorion develop from trophoblast. आज ही हमने किया. And embryoblast develops into fetus. By the way, where did trophoblast and embryoblast both come from? Trophoblast, embryoblast both have come from morula, and morula has come from zygote. तो एक ही जाइगोट से मोर्यूला बनता है, मोर्यूला से ही ब्लास्टुला बनता है, और ब्लास्टुला में ट्रोफोब्लास्ट होता है, एम्ब्रियोब्लास्ट होता है, एम्ब्रियोब्लास्ट से फीटस बनता है, ट्रोफोब्लास्ट से एम्ब्रियन कोरियन बनता है. गोल्डन वर्ड, whatever is the genetic constitution of the fetus, same is the genetic constitution of amnion and chorion. तो अगर amnion chorion cells के अंदर we get 321st chromosome trisomy 21, then the same genetic defect is also there in the fetus, and we will request this mother, let's go in for an abortion of the child. And what is this beautiful technique called as amniocentesis is done. तो इस तरह से amniocentesis किया जाता है. Nice logic, इसे याद रखना. And then sir, we have some extra points from meat point of view. In mammals, in many mammals, छोटे-छोटे mammals में there is a bone found in the penis which is called as a baculum. Baculum is the penile bone. तो penis में एक छोटा bone होता है called baculum in lower mammals. Rats, mice, rabbits, उनके अंदर erection के लिए एक bone का support होता है which is called baculum. And testes remain intra-abdominal throughout life in elephant, whale and camel. Sir, elephants, whales, camels are very slowly moving animals. Means उनका body में metabolism हमसे slow होता है. So they have got less metabolic rate and less heat is produced. And whales, elephants, camels are large animals जिसके अंदर बहुत बॉडी वॉल्यूम है, तो हीट कम बनती है एंड बॉडी वॉल्यूम ज्यादा है, सो हीट गेट्स ब्यूटिफुली डिस्ट्रीब्यूटेड इन द एंटायर बॉडी एंड द बॉडी टेम्परेचर इटसेल्फ इज नॉट 37 degrees, it is about 34 degrees, which is the optimum temperature for spermatogenesis. So testes develop in them, but they don't descend out through the inguinal canal. They will remain within the abdomen in elephant, whale and camel, slowly moving animals with less heat in their body, big surface area for heat to distribute, and testes remain intra-abdominal in that. ये अच्छा point है याद रखना. And there are cyclic changes in the female reproductive system of non-primate mammals, which is called estrus cycle. So sir, हममें menstrual cycle था. If you remember in primates, apes, humans and monkeys, we show menstrual cycle. But in other non-primate animals, cows, deer, sheep, lions, etc., they have something called estrus cycle. Sir, estrus cycle में क्या होगा? They will have ovulation only once in a year. We have ovulation once every 28 days, once every month. So 12 times in a year. In these animals, ovulation is only once in a year, maximum twice in a year. If it is once in a year, it is called as monoestrus. Monoestrus once a year, that is deer or sheep. And say cats and dogs, it is twice in a year, which is called as polyestrus. And only during ovulation is secreted testosterone or estrogen and progesterone, and that will create a libido or a sexual excitement. Primates, once with menstrual cycle, are sexually excited all the time. But in these animals, only during ovulation, estrogen, progesterone and testosterone are secreted, and that will create a feeling of libido or a sexual excitement, and that is something called as the breeding season, and a strong urge of sex is there, and breeding season will happen. So there is a libido phase, something called rut phase, R-U-T, rut phase. They are sexually excited. Importantly, हमने अगर egg fertilize नहीं होता है, our endometrium will burst and will carry with it menstrual fluid. But estrus animals में, जिसमें ovulation is only once or twice in a year, if the egg does not get fertilized, unfertilized egg passes out of the vagina without rupturing of the endometrium. So there is no menstrual flow or estrous flow. Estrus में blood flow नहीं होता है, unfertilized egg निकल जाता है. So sir, non-primate mammals have in their estrous cycle, ovulation is once or twice in a year. Only during ovulation they feel libido or sexually excited. If the egg does not get fertilized, unfertilized egg will pass out through the vagina. Menstruation or rupturing of endometrium will not take place. ये याद रखना. And then we have a concept called IVF, in vitro fertilization or a test tube baby. Fantastic concept. Next lecture में हम लोग ये डिटेल में करने वाले हैं. And surgical removal of the testis is called as castration. Surgical removal of testis is called castration. And समझो, many men after the age of 60-65 years develop a cancer of the testis. And testis के cancer cells can spread to all the parts of the body and can be dangerous. तो सर testis को surgically cut off किया जाता है. And what is that scientifically called as castration. ये castration याद रखना. And spermatogenesis is completed in 74 days. Right down from germ cell division to form spermatid, and then spermiogenesis to form sperm. What is the time required for germ cells to form spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid and sperm? That entire process takes place within 74 days. And Sertoli cells are a feature of mammalian testis only. So only mammals we have supporting nerve cells which are called as Sertoli cells. And the last one there, vitamin E is required for normal functioning of testis and ovary. For testis and ovary to do spermatogenesis and oogenesis, we require vitamin E, and with vitamin E, you will have successful sperm and egg production. So these are some extra points from the NEET point of view. With this, we have finished the biggest chapter of biology, human reproduction. Excellent concept. Lots we have learned in this chapter. In the NEET paper, maximum questions will come from this chapter, reproduction. You can expect out of 90, at least 4 or 5 questions coming from this chapter of reproduction. Next session, we will start with reproductive health. Excellent topic again. We will talk about placenta, pregnancy, parturition, lactation. We will talk about contraceptive methods, how babies are not to be born. So how oral contraceptives work or coppeties work, etc. We'll know and analyze that. And we will talk about the concept of IVF, in vitro fertilization, how a test tube baby is created. Beautiful topic. Next chapter, reproductive health. So we will have this starting soon. This chapter, all of you, I want you all to absolutely perfect it. Very soon we are starting with your Sunday test, and you will have this full chapter coming in your Sunday test. It will be a 90 multiple choice question paper on 360 marks. So this is going to be a big paper. आपके छोटे छोटे DCT में तो आपको 40 out of 40 easily मिलता है. Now when the whole chapter is there, you should aim for a full 360 score. Prepare it thoroughly well. Okay? Take care. God bless you all. Bye-bye.